Eligibility for flu within North East Northumbria was quite a large population, approximately 1.6 million people, but specifically frontline healthcare workers are eligible to have the flu vaccine. What would you tell your team, colleagues across Newcastle, across all of our hospitals in the North East and North Cumbria as to why it's so important to get it?
So I think first and foremost it protects you against influenza, against the flu. We know that people if you're frontline, you're more likely to be exposed to influenza. So you're less likely to get ill, and that means you can work, you can feel healthy through the year. So that's very important. And actually, a lot of us have vulnerable family members, over Christmas and so on, and other times of the year, and we're less likely to transmit influenza to those people that we love. And I think the other aspect to this is it's really important in protecting the whole workforce, but also then protecting the people we're looking after. Mm-hmm. And I think unfortunately every year we do get outbreaks of influenza in amongst vulnerable people, either on care of the elderly wards or transplant wards or neonatal wards. Occasionally that can really be devastating. Quite a few people can die during those outbreaks, and we know that protecting the workforce can help reduce those hospital infections. I'm not saying that every hospital infection is because people haven't been vaccinated at all, but there is just a reduction, and it's just part of the ability to it's one of our tools in infection control to reduce infections.
Absolutely, and the NHS sees more people over winter as well, so that's probably another reason as well.
Absolutely, and I think that we know that when we have a really bad flu season, that less people come to work at the worst time. That we're really struggling already with numbers of patients coming in. If we've got a lot of people off ill, it can make the situation much worse as well.